Welcome to Coruzant Technologies, home of the Digital Executive Podcast.
Welcome to the Digital Executive. Today's guest is Carly Rowe. Carly Rowe is responsible for the patient access, identity, and care management product portfolios at Experian Health. With a diverse background across credit, retail, and healthcare, Carly is responsible for finding new ways to leverage Experian's data and analytical capabilities to develop new, innovative solutions for the healthcare industry. Carly holds a Master of Business Administration from Arizona State University and a bachelor's degree in Marketing Management and Retail Management from Syracuse University. She resides in Scottsdale, Arizona with her husband and two sons.
Well, good afternoon, Carly. Welcome to the show.
Thank you. It's a pleasure to be here.
Awesome. This is great because I know we've probably worked on this thing to get on the show here. We scheduled this over the last several weeks, but there's just been a lot of great communication in between to get there. And obviously we got to connect before the podcast. So I just want to let you know, it's been really a pleasure working with you and having you on the show. So Carly, we're going to jump right into the questions. And we're going to talk a little bit about you and hear what your story is. You lead the business unit at Experian Health as the Vice President, Patient Access, Identity, and Care Management Product, and have experience in new product development, business planning, marketing, and strategy within healthcare, as well as retail, right? Could you share with our audience any key moments in your career path, secrets to success you learned along the way, and what really inspires you?
Yeah, there's been a few key moments. I think the ones that really stand out are the times where I've changed the industry, or I've changed my role, moving from retail or credit to healthcare, and just serving in all the different functional roles along the way. There's a certain thrill and excitement when you start something new and you go into uncharted territory. It's kind of an exhilarating feel. And honestly, that's what I'd say is a secret to a success. All of those transitions, I was excited to be uncomfortable, right? And that's what I'd say to others: be comfortable getting uncomfortable and be open to those ideas. Within my teams, I always try to, foster this culture to say, celebrate the failures and fail fast, and just be open to those new ideas and celebrate the whole process around ideation. And I think that really is what kind of inspires me every day, right? Healthcare is so ripe for having an impact and making positive change. And so I look across the industry, I see so much opportunity to do that and to work with people who are in that same mentality. Think about how to make a difference, how to leave the industry better than when you joined it.
I love that. And, the fact that you've kind of traversed different verticals and industries, I think has also contributed to, obviously part of your success. You've got more diversity as far as that learning and experience, but healthcare certainly, Carly, as you know, I was in healthcare for 20 years as well on the tech side. So healthcare is certainly my passion. Thank you for sharing that. So Carly, now that the pandemic is at this inflection point, what are your business unit's plans for growth going forward, and how might it look different than it did the last 14 or 15 months?
Yeah, you might be surprised to hear me say this, but the pandemic really didn't change the focus. It just accelerated the timeline for the solutions and tools that were underway, right? You look at the digitalization of healthcare. This trend was growing and increasing, and consumers more and more have been expecting a similar experience in healthcare as to what they get today from banking or online shopping. And so, over the last several years, there's been a focus on how do you create solutions to put services in the hands of consumers earlier in their healthcare journey, right? Think about tools that allow patients to schedule appointments online or through their device, or, access your medical information online, or, pay your copay from your phone before you ever get to the doctor, right? The pandemic really drove a lot of patients towards this digital experience for healthcare. But this is an expectation in the industry that's likely going to continue, maybe not at the same level as to what it was during the last 12 months, but it's certainly going to continue at a much higher rate than kind of the pre-pandemic. In a similar way, the industry also, we were moving towards the concept of really understanding a patient's identity holistically, right? The industry was, I'd say in our earlier stages of really understanding the benefits of having a 360-degree view of the patient, to consider non-clinical or those socioeconomic factors and care decisions, and really contribute to that accurate view of a patient as they interact with a healthcare provider. And this concept, it was resonating pre-COVID, but COVID totally changed the patient interactions. And so the need to know your patient when you've never met them before has placed an entirely new reliance on, an importance, I would say, on really understanding the patient identity. So, I think that conversation that's going to continue on this piece and how that translates to making sure that healthcare is serving the needs of a lot of our underserved populations, right? How do you truly make healthcare accessible to all? And so we're going to continue that dialogue with our clients to really understand, how their needs are shifting, what's accelerating, what's decelerating. And we're going to continue to adapt many of the tools and products that we've been launching even kind of pre-COVID. So it's continue the path we're down and continue to listen to our clients and accelerate when we need to accelerate solutions that are going to help with kind of the whole concept around, the healthcare digital front door.
That's awesome. And it's good to hear that you all, like everybody else, obviously had to make some changes and pivot, but you accelerated kind of your product lines and your services, obviously. But the good news is you didn't have to, take a big hit either financially or any other way. So that's good to hear, and hopefully that's going to help contribute to get our economy back on track. So thank you. So Carly, this is a technology publication and platform, and we want to focus a little bit on that today. You're obviously leveraging probably some new and emerging technologies within your business or your tech stack, right? Is there anything you might be able to share with us today, or at least give us a peek what's around the corner from your perspective?
Yeah, sure. One of the areas we're focusing on, I'd say further development is, really helping the industry make better use of the data that's at their disposal and also make it actionable. Last week I had the pleasure of being on a panel and, a participant was commenting on, the healthcare industry is swimming with data, right? That can be both a good thing and a bad thing though, because you need to be able to make sense and you need to be able to take action on that data. And, this is kind of core to what Experian Health does, right? This is an Experian more broadly. So a lot of our tools, we're really focusing on, harnessing the power of that data, really focusing on how do we drive those analytical insights and provide that to our clients so that they can take swift action, right? Healthcare is pressed for time, right? You think about the fast-paced environment of registration and all that's going on within our healthcare systems. It's so important to have that data be accurate and to be actionable so that you're not slowing down that entire care delivery process. So we're definitely continuing to focus on how to provide new insights to the industry and combinations of different data elements to make that actionable so that they can make faster, better decisions.
Thank you for sharing that. And that is such the case across any industry, but healthcare is especially important. Having, the data at your fingertips, but not just the data, and because there's a ton of it, but having machines do some additional, obviously they can work a lot faster and produce more actionable insights than humans can. But obviously that's a team effort between the human and the machine. But I can't wait to see what the next few years brings around analytics. So thank you again for sharing that. So Carly, last question here. Is there something you can share from your career experience that would be helpful for those to grow their career either in healthcare, tech, or business leadership in general?
Oh, yeah. I'd say if you're thinking about making a career change, into a different role or a different industry, maybe you've never, been in the healthcare industry and you're afraid of starting over, don't be. There are more commonalities across industries and experiences than others might think. And I really think it's more about, how you think. And we talked earlier about, patients are now expecting to have a similar experience in healthcare as to what they do when they log into their bank or they go shopping online. And it's really a focus, and healthcare, I think, will see a massive transformation in the years to come that is around creating a convenient and positive and seamless patient experience. And, I often sit back and reflect on my time in retail, and I remember a book I read, Why We Buy by Paco Underhill, and it was all focused on the science behind why people buy. It matters where you place things. If you've got the candy bar at the checkout of the pharmacy, we're probably all guilty of buying one too many, or the batteries at the grocery store. Healthcare is similar, right? What do patients want when they're going to interact with their information or their doctor in a telehealth visit, or what services do they want to have at their fingertips? It's really the mindset that you carry in. So, I'd say to others, if you're not in healthcare today, don't think of it as something so foreign or so different than maybe the industry you're in today. Bring forward those experiences. And I think, we're starting to see a trend of a lot of different executives coming in from other types of industries and helping healthcare actually, I would say, quicken the pace of their journey in some regards by taking learnings from other industries and bringing that forward. And I think, again, that just speaks to the sentiment of, bring forward those different ideas. That's where creativity and innovation kind of foster some great improvements. Absolutely.
And like I said, we did talk about this a little bit earlier, but your diverse background as far as the various verticals you worked in, like retail and healthcare, et cetera, it's certainly contributed to making the world a better place. And we do appreciate that. And Carly, it was a pleasure having you on today, and I look forward to speaking with you real soon.
No, thank you for the time, Brian, and have a wonderful day.
Bye for now.